How's it going, guys? It's Paul Myers, licensed professional counselor.
Hi, I'm Dr. Nicholas Westers. I'm a clinical psychologist at Children's Health and associate professor at UT Southwestern Medical Center.
Hello there. This is Lisa Vernon, district social worker and coordinator for Student Family Services.
Hi, I am Dr. Eunice Yuan, currently a board-certified adult, child, and adolescent psychiatrist.
I love my job. One of the things that I always wanted to make sure I could do, whatever career I chose, was to be able to have flexibility and not have to do the very same thing every single day. So a lot of people that go into the field of mental health want to do just therapy, and that's great. I do therapy. That's my primary job at Children's Health, where I work with young people nearly every single day in therapy. And so I get to do therapy, but I also get to do, as a psychologist, psychological evaluations or testing, which are all-day assessments in which I administer a bunch of different tests and measures to a student in order to determine what is really going on, whether it's a diagnosis or just a better understanding of what's going on in the mental and emotional health of a young person, and then bring that information to them and their parents and their family to be able to help support them in whatever way they need. So I get to do therapy. I get to do psychological evaluations and testing. I also get to teach. I do presentations all throughout the US. I get to teach other psychologists, other therapists, and sometimes speak at schools and speak within our university and our hospital. And I also supervise. We have a postdoctoral psychology fellowship program here at Children's Health, where we are training the next generation of psychologists every year. So I get to meet every week with one of our psychologists in training to help them become better psychologists for the future. And I also get to do research and learn new information that's never existed before and contribute new information to the world to help better understand people's mental health and psychological needs, and then learn more and present more. So I get to do all those things, as well as work with our media relations team at the hospital. So I get to do TV interviews, radio interviews, magazine interviews. It's really exciting, and even have my own podcast that's pretty much everywhere on all the podcast platforms, that's international. So that's one of the greatest things, being able to be a psychologist and having a doctorate, is to reach more people outside the four walls of my office. It's a journey to become a psychologist. I grew up in Michigan, and I did college for 4 years in Oklahoma, and then did graduate school for 5 years in Virginia, where I got my master's degree along with, in the same journey, of a doctoral degree. So my doctorate was what we call a nested program, in which we got our master's degree 3 years in, and then 2 years later, we got our doctorate. But to get a doctorate, to become a psychologist, you also have to do what's called a predoctoral psychology internship for 1 year. And I did that in Miami, Florida, at the hospital there before I graduated with my doctorate. And once I graduated, I sought more training and did a postdoctoral psychology fellowship in Houston at Baylor College of Medicine and Texas Children's Hospital, where I specialize working with teenagers, which is what I love to do today. And I've been here at Children's and UT Southwestern over 10 years, going on 10 and a half, 11 years. And it's really exciting. If you're thinking about a career in mental health, I encourage you to think about becoming a psychologist, not necessarily to figure out your own issues, but be able to help others understand their own, show self-compassion to themselves, and grow as people. You don't have to be the brightest person in the world to get a doctorate. You just have to have perseverance, endurance, and fortitude, because it's a long journey, but it's well worth it. It felt like it was forever, but now it feels like forever ago. So whatever you decide to do, I hope this video helps you make that decision, and I wish you the best in all that you do and all your career endeavors. So best wishes.
I am at Vaughn Elementary today. My day never looks the same. We get support referrals all the time from different campuses, and today's campus needed some assistance and support with a family and a student. And so the really cool part about my job is that I get a chance to collaborate with other professionals in the same department that we're in, which is Student and Family Services. So my goal after today's meeting is to swoop back around and connect with some of my colleagues, as well as reach out to the parent. Our parents are our kids' first teacher, and we cannot do any of this work without them. So I'm going to engage the mom and do some other supports and see what else is out there. But I just wanted to let you know that I am rocking and rolling and on my way. And today is just part one. So part one of a day in the life of a social worker. We have more filming to do. Stay tuned. I am now at Trent Middle School. Trent Middle School is significant for me in lots of ways. One of my mentors in the district, Dr. Sean Perry, and I used to work together when I was a district counselor and social worker at the alternative school for students K through 8, and I stayed there for 9 years and work alongside some of the greatest educators that have embarked in my life. And Dr. Perry was definitely instrumental, is definitely instrumental in my development as an educator. He saw my purpose, he saw my passion and my strengths, and he pulled a lot of things from me that I did not know that existed because he's just that great. So today I am here to talk to one of my students that's on my service. She's on my service, and her mom reached out to me and wanted me to follow up with her. I was out at a conference last week and was unable to circle back with her, but I will do that today and check in with her and see how she's doing. So I want to make sure that everything's good, and we'll talk soon. It is now almost 2 o'clock. I have been inside Trent Middle School to visit with a couple of students. We had a department meeting. So I was here to follow up on the request from the parent, check in with the student, talk with the assistant principal, as well as the counselor. And in this case, I met with the 504 coordinator. And 504 coordination, or the term 504, is an accommodation. It's a legal program that provides services and accommodations for students that are in need of resources. So I was following up with that. And now and then you got to document. So documentation is important in this work, because if you didn't document it, it didn't happen. And we're documenting the fact. It is almost time for the school day to end. As you can see, every day doesn't look the same. Hope you have a great rest of your day, and we'll talk soon.
What I do for a living is I mostly sit and listen to my clients, bring up different variety of problems they have, whether it's anxiety, whether it's depression, whether it's marriage problems, whether it's ADHD or addictions or whatever, just a variety of struggles that people could have. They come into my office, they're able to share and disclose what they're going through, and I'm able to support them, help guide them to navigate those issues and bring some solutions to the table, recommendations, and really try to treat whatever their situation is, and just overall just trying to help people. The other back end part of my job is I do own my own group counseling practice, so there's a lot that goes into that as far as billing, paperwork, credit cards, intake forms, insurance claims, accounting, marketing, new client acquisition, client retention, and just overall running the business side of things and just making sure everything's squared away with all the paperwork. So I will shoot a few other videos of just me sitting and doing the work and explaining what we're doing, and we'll go from there. All right, take care. So in the office, most people come in and they just hang out on that couch, and then I'm over here on this side, and I just sit and listen mostly and I'll usually take notes sometimes in session. But it's really not, it's a very intimate setting where privacy is the goal, and we're required to keep confidentiality. So the things that clients share stays safe and confidential. So most of my administrative work is just done from my computer. So I would basically just log into my EHR software and do chart notes. So every time you see a client, you have to do chart notes for that session. Every session has the note requirements. The state of Texas and our licensing board requires us to keep a lot of documentation as healthcare practitioners. And so there's treatment plans we have to do. There's chart notes after every session, and there's a lot of billing and filing insurance and charging credit cards as well. So each session I would do would have probably 5 to 10 minutes of notes I would have to do after every hour session. So usually at the end of the day, I'll just power out all of my notes after seeing everybody in a row, and I just crank out all my administrative work after I'm done with my sessions.
My affiliation is from Connecticut, Yale Child Study Center, and Yale New Haven Hospital.
So what do I do at work? There are two settings that are involved in children's mental health. One, I take care of children who are teenagers, aged from 13 to 18, in this setting called intensive outpatient program, where children who struggle with a variety of mental illness, ranging from depression, anxiety, ADHD, post-traumatic stress disorder, etc., they may be referred from the emergency room, or they have just complete a inpatient psychiatric hospital stay. So I will take care of this group of children and continue seeing them and help them to stabilize before they can continue back to the work, back to the school setting in the community. So my role in this group of children and teenagers will include assessment in terms of helping diagnostic clarity that guide treatment option and aftercare plan. And the treatment option could include medication and variety of therapy treatment. My other setting that I do in my daily work, I also work with parents. As you know, like children, mental health involve so many different nuances and input to provide a caregiver support as well. And oftentimes parents, sometimes they also struggle with mental illness. My other hats in my job would also involve in a parenting clinic. For parents, meaning adult parents, they will come to see me with a variety of mental health issues and also similar setting that I have. I provide medication consultation and also therapy treatment. So for those who will love the challenges to take care of children and also the family, to provide a comprehensive care. So the way I mean is that for psychiatry, it is a bit different from other mental health provider or industry, is that psychiatrists, we receive medical training and follow after the medical school training. We have residency training for the adult psychiatry and also child and adolescent psychiatry fellowship. It's a long commitment of training, but they provide you a comprehensive assessment to understand the so-called concept called biopsychosocial cultural formulation of the whole case. We are not only looking at the biology of how body and brain works, also looking at the psychological component of the cases and social determinant, how my social culture may play a role in the child cases. So, for example, patients who come in have presenting depression and anxiety symptoms. They may not only coming from the mental psychiatric condition. They are mainly a medical condition. They can also present a similar way as well. So we need that medical medicine training help us to identify, to do the appropriate diagnostic assessment. So that is something quite unique from other mental health provider training, and so we are also oftentimes will be the leader in the medical setting. A lot of leadership and coordination involved in clinical setting. If anyone who are interested to learn more about the career choices, like would love to talk more and have a presentation or whatnot.
If you wish to learn more about the mental health industry, scan this QR code. Thank you so much for watching this video.